our coronavirus update for our group here in LA County, and I'm hoping that people have found these sessions useful so far. It's been very useful for me to do this reflect on questions and issues face in my other life and my other job, and so I appreciate the sorts of the commentary and questions that you guys have had over the last several weeks. Before I jump into the presentation, I'd like to go ahead and just say a quick word of prayer. Then we'll get right into the presentation. So bow your heads. Gracious Kind Father, we thank you again for another day and for another opportunity to discuss and share amongst ourselves our curiosities, our questions, and the knowledge, wisdom, and experience that you've provided for us collectively. May the information shared be useful, edifying, and help us to help others and ourselves. In Jesus' blessed name I pray, amen. Okay, so as usual, I start with just a little bit of trends in California and Los Angeles, just some of the numbers to put things in perspective. And then there were a couple of questions that were submitted to me directly that I'll try to address, and then we'll quickly go into open Q&A, where we'll open up the mic for people to ask whatever questions that they might have. As I usually do in the beginning of this broadcast, I like to show, again, this natural history, this sort of timeline, if you will, of what it's like for coronavirus or COVID-19 infection. And again, right now, it looks like we probably have somewhere between 8 and 10% of people in Los Angeles County have probably been exposed or have been infected or currently infected. That means we have a large proportion of the population, at least 80% or more, closer potentially to 90%, who are still susceptible to infection. Most of the spread of this disease is occurring through people who are without symptoms, so they're asymptomatic, or they have mild or minimum symptoms at best. And when we're exposed, as an individual exposed, it takes a little while, somewhere on the order of 7 to 10 days, for the virus to replicate within us, to become high enough in concentration where we then are contagious. And again, most people are without symptoms or significant symptoms, and therefore are contagious and transmitting this virus person to person, either by spread of droplets in the air in close proximity, or because they are spreading it on surfaces, which then a susceptible individual touches and then makes contact with the mucous membrane, such as their eyes, the nose, or their mouth. And so again, the majority of people are asymptomatic. In this graphic, while it says symptomatic here, you should note that at least 80 to 85% of people are asymptomatic. If you become symptomatic, the majority of people have mild symptoms at best, maybe like a very mild cold or flu-like illness, and there have been other mild symptoms like rash and a variety of other things that have been denoted or observed. But most people actually have symptoms, signs that resolve on their own over time. But even after the complete resolution of symptoms, you can still remain contagious for a period of time. And again, it's important to think about this period of time being somewhere probably on the order of days to potentially a week. But you may still have symptoms, and most people believe at least 3 days after your symptoms, particularly a fever, have gone away, that you're still contagious. After which, you are no longer contagious. And again, we're still learning a lot about this virus. We're learning once you've been sick and you recovered, whether you're immune and how long you stay immune, and therefore whether you're susceptible for getting reinfected. So we're learning still a lot more about this virus. And so again, really important to remember that the spread of this disease is asymptomatic. And I say that because what I want you all to remember is that you should be thinking in your brain as you walk around, as you walk about, as you work, as you do things, that anyone around you, unless they are someone you've been around consistently or continuously and you can vouch for their whereabouts, anyone around you is potentially infectious or contagious. That's the way you should think about this. Anyone around you is potentially contagious. And therefore, how do you protect yourself? I'll come back to that. If I look at the trends in California, again, the very first week we started doing this, April 6th, the number of confirmed cases in California were 16,323. The number of deaths were 385. The 385 number was up tremendously just from the 10 days before that or so, when it was only 70 deaths. So if we look at the data now, again, looking at the trends, and again, if you look at the number of cases per day in California, what you've seen is just this sort of plateauing, right? You have these sort of false plateaus. There's an increase, a false plateau, another increase, a false plateau, another increase. That's in terms of number of cases. And the number of cases will go up as we test more people. So again, one of the things that we follow as evidence of whether or not this really is increasing or decreasing are the number of new deaths. And again, when you look at the number of new deaths in California, you saw a rapid rise in the number of new deaths. And over the last few weeks, we've seen this plateauing of deaths. Now, this is death rate, or the number of deaths per day. And you can see it's plateauing, which means that we still have new deaths each day, but that number isn't increasing. And so that's probably the most hard evidence that we have, that even though the total numbers are going up, the rate of those total numbers are staying relatively flat. So again, just looking back, reflecting back on 5 or 6 weeks, we went from 16,000 cases in California to 70,000 cases. We went from 385 deaths in California to just under 3,000 deaths in California. So again, very, very important to just think about just the magnitude over a very short period of time. Now, when we look at sort of the predictive models and curves, I'm not sure that they mean a lot, but what you can see is this idea that things are flattening. Again, this was our predicted line based on models, and this is what we ended up with, which is a flattening, if you will, in Los Angeles County. And you can see almost all the counties have sort of flattened, okay? Flattening does not mean there aren't new cases. It just means that the rate of new cases is remaining about the same. We really won't be seeing a decrease in the number of deaths per day until the curve doesn't just flatten, but it begins to go down. So we have some time before that actually happens. Now, if you look at those numbers that I showed you on the slide before, we have 70,000 total confirmed cases in California, just about 3,000 deaths. And when you look at the number in Los Angeles County, we're just under half of that as in LA County for the state, and more than half of that, the deaths for the state, are in LA County. So LA County represents a very densely populated, busy part of the state. And it's sort of to be expected based on the population. Although it's overrepresented because LA County probably has 1/4 of the state's population, yet we represent almost half of the cases and over half of the deaths. So there's an overrepresentation, and I think a lot of it has to do with it being an inner city, there being crowding, there being lots of people with comorbidities, and obviously a homeless population and a poor population here in the city. This is a graph I show you all each week, and it just talks about in LA County, if you look at the number of people who are hospitalized over LA County, this is actually data that represents 70 different hospitals. Well, the numbers actually have remained relatively flat. So the number of people in the hospital, and again, this is in the ICU as well as in non-ICU, they are about the same. The number of people under investigation, meaning these are people that we've sent tests on that we're awaiting test results, it's remained about the same in the last 10 to 14 days. So these are overall good numbers, and these are the sort of numbers that we're going to be following over the next week to month as we sort of decrease some of the restrictions, if you will, with regard to businesses and allow people to go back to work. I wanted to let you all know that if you have turned on the news tonight, you will see announcements that the stay-at-home order is being likely extended to August. This is from Barb Ferrer, who is our director of the Department of Public Health. Excuse me. However, the orders, the conditions around those orders and the places affected by those orders will be likely amended substantially. So Los Angeles County is likely going to still have people, if they can, still not working, if they can, telecommuting, etc., and gradually allow people to go back to work. And when they go back to work, those businesses will have to have uh, a plan to mitigate infection of both their customers and their employees from getting infected. And those plans will include the distancing parameters that have been in place, hand hygiene, and including soap and water and other things, as well as mandating that people, both customers as well as employees, wear masks. So each business that's opening is required to submit a plan that needs to be approved by the city, county, or the state before reopening. But again, you can see in LA County, we represent a large share of cases down here in Southern California. All right, so let me get right into a couple of questions real quick. And then we will have, I think, the balance of time for whatever questions that folk want to talk about on the call. One of the questions I received was based on someone who I'm sure just is watching the news and is seeing lots of reports that come out. And one of the things last week that we talked about stroke, particularly in young. And so we talked a little bit about that last week. This week, one of the things that have come out has been a study that was published that showed a link, and it was, I think, published in the journal Science, a link between severe COVID-19 infection, meaning people having complications and or dying from COVID-19 infection, and vitamin D deficiency. So is there a link? And the answer is yes. So if you look at the way the question's been asked, meaning let's take all the people who have complications from COVID-19 and or death from COVID-19 and look at people who don't have COVID-19 infection or death from COVID-19. And let's look at what variables seem to be associated with a higher risk of dying or complications. That association in that paper strongly suggested a strong correlation between vitamin D deficiency and people having complications and death from COVID-19 infection. Now, I make it very clear, this is a strong correlation. This was not an experiment where someone was able to establish cause and effect. So no one should read this data and say, like, if I have vitamin D deficiency, I'm going to get COVID infection. Absolutely not. If I have vitamin D deficiency and I get COVID infection, I'm going to die. Absolutely not. What it does mean, however, is some evidence of what we know, that people who have vitamin D deficiency, we know that there's already established mechanisms, if you will, of immune function that are tied closely to have vitamin D metabolism. So we know that vitamin D functions very importantly in strengthening, among other things, but strengthening the immune system. It's also important in bone health and other things as well. But we know that it's also important in the way the immune system functions, particularly how it adapts and how it responds with regard to inflammation as a means of controlling infection. And so we already have seen that people with vitamin D deficiencies, or I should say that people with autoimmune dysfunctions, for example, have a higher correlation or likelihood of having vitamin D deficiency. So again, hard to establish for sure that's cause and effect, but we do know that vitamin D is important in immune function and that people who have deficient vitamin D levels have some other complications as well. So what I can tell you is if you have known vitamin D deficiency, you should make sure that you're getting your vitamin D supplementation. If you do not have vitamin D deficiency, taking extra vitamin D is not going to make things better. And in fact, too much vitamin D can cause liver problems. So the corollary question to this is, I'm not sure whether I have vitamin D deficiency. Maybe I should go get a check. And yes, there are groups of people, particularly women, over a certain age, particularly over the age 40 or even 50, but definitely as you get older, who should have, in your postmenopausal, who should have your vitamin D levels checked. Okay, so if you haven't had your vitamin D levels checked, consider getting your vitamin D levels checked. Here in sunny Southern California, the risk of vitamin D deficiency is actually much lower than it would be, say, for example, in Seattle or Alaska. The corollary to that, however, is that our melanin, meaning the pigment in our skin, prevents some of the absorption of sunlight, which we get a lot of natural vitamin D from. And so African Americans, consequently, particularly the darker the skin, may be at higher risk for having vitamin D deficiency. So the point being is, if you're female, you're older, you're postmenopausal, and you may actually have a tan, let's just leave that at that, a very strong tan, you may have a higher risk for vitamin D deficiency, and you should consider getting tested as already recommended by your doctor. And if your vitamin D levels are very, very low, consider taking replacement. If you do not have vitamin D deficiency, I would not recommend taking vitamin D supplementation. If you're already taking supplementation, you should be followed by a physician, and they should be assuring you whether you're taking adequate amounts. Taking additional or extra amounts of vitamin D are likely not to be helpful and could be harmful. So great question. And I think it's really important to remember we always have to separate sometimes the things from association versus something being causal. And maybe deficiency, but this is something more common in people who have poor diet, poor nutrition, and people who are more frail and elderly. So if you are eating good or well, good nutrition, and you're getting good sunlight, you probably have all there is that you need to make sure that you have adequate vitamin D levels in your body. Okay, the next question, I'm paraphrasing it, but someone asks us, sort of, what is the most important thing that the public can do to prevent infection? What's the most important thing you can do to prevent infection? Last week, we talked a little bit about what you could do to prevent complications. And there are not a lot of things you can do to prevent complications other than making sure you try to stay healthy, which has to do with keeping your stress levels down, has to do with being active, good exercise. And if you have chronic diseases or illnesses, making sure that they are well managed, cared for, and that you're compliant or taking whatever medication or therapy prescribed for that. So that's trying to reduce your risk of having complications. But the complications occur only if you were infected. So this question is, what can you do to prevent infection? And if you can prevent infection, then you don't have to worry about complications. So it's a great question. The most important thing you can do to prevent infection is, number one, reduce your exposure. And there are two ways to reduce your exposure. One is simply just to prevent unnecessary commingling or exposure to people who may be infected. Now that we are living in probably a county where we have somewhere between probably 8-10% of people who have been or are infected, that just means that if you think about it, when you walk around or go to the supermarket or even go to work, that's probably somewhere between 1 in 10 on the low end, on the high end, to 1 in 30 to 1 in 50 people actually are infected and they just don't know it. So one of the most important things that you can do on the one hand is just to reduce your exposure time to people. Now, that does not mean that I am a big fan of everyone just staying cooped up in their room or in their bedroom at all, or even cooped up in their house. I think you should get out. I think you should be out walking and being active. But it does mean that we should limit unnecessary contact in that manner. Okay. The second thing that you can do from an exposure standpoint that's really important is you can provide barrier exposure. The barrier exposure is what we talked about a couple of weeks ago, and that is wear a mask. So I believe you should be wearing a mask when you go out all the time, period. and you're going to be exposed around other people. Now, if you're out going for a jog or riding your bike or what have you, one could argue maybe that's not as protective or important because you have such casual contact with people, it's very limited, and you have the diffusion of the open air. And so we could argue about that if you like. But no question, visiting people, being in confined spaces, being at your job, work, all of which is enclosed in confined spaces, you should have a mask on. And individuals around you to protect you should have a mask. So you wearing a mask protects them wearing a mask protects you. Okay. The second thing that you can do that's associated with barrier protection, that's not associated with barrier protection, but that's also a preventive strategy, is washing your hands. 20 seconds. You can sing Jesus Loves Me, This I Know. You can sing Happy Birthday twice. Doesn't matter. 20 seconds washing your hands with soap and water. That or hand sanitizer with 70% or more alcohol-based solution. Doing that as often as you can is extremely important, and cleaning accessible surfaces. So we've talked about this before, but these are the three things that you can do that you have control over. Unnecessary exposure in the public or to other people who are undifferentiated, who may be infected. Unnecessary exposure or prolonged exposure to those individuals. That's one thing you can do. Second thing you can do is you can wear a mask or make sure people around you are also wearing a mask, okay? Particularly when you're out and about or at work, etc. Third thing you can do is wash your hands. Those are things you can do definitely to prevent infection. Okay. That's it for the prepared questions that I had this week. We now have time for Q&A. So David, if people have typed in questions, we can go there, or people can unmute themselves and ask. Any questions? I don't hear anything here. Let's see.
Oh, remote control, I can't find it.
Are we unmuted?
No.
Was I freezing? Okay, we're unmuted. Did the presentation come off clear, or was it freezing?
It's been freezing.
There was.
I could see you very clearly. I could see the questions
But
and answers.
you did freeze a couple of times.
Okay. I apologize for that. I've been in the same location for the last 6 weeks. I apologize. I have.
Ozempic is helping many people with type 2 diabetes like James lower their blood sugar.
So I think it's my phone service potentially. Okay. All right. Well, let's go. If we can, anyone have any questions? We could go for questions.
Yeah, I have a question.
And maybe what I will do. Go ahead.
My question, can you hear me okay?
I can hear you perfectly. Can you hear me?
Great. Yep.
Okay.
And for me, there was just a few hiccups. I'm not on Zoom, so I could hear, but periodically your voice would get a little bit garbled. Could be because there are definitely more people out, so there could be more interference out there. Anyway, the question being, I know you've touched over the weeks on sort of the airborne ability of the virus. So assuming we're trying to lower our exposure as much as possible, sometimes I find myself in a bay where there's 4 of us and there's no windows in the bay. And occasionally we're all required to wear a mask. I think you spoke to that. But when we're in our bay, where we're in our personal cubicles, the mask is not mandatory. So should someone sneeze, can you speak to maybe the weight of the particles and to what degree that might remain airborne and then be pushed around by the AC?
Yeah, so first off, let's back up and let me know if I freeze or you can't hear me, but let's back up to the notion that you're in a work environment, which is in an enclosed space, and that you're at cubicles, which may be like 5 by 5 or 6 by 6 or no more than 8 by 8, right? And what I assume are that the cubicles have a certain height and you're sitting down, right? So if people are sitting adjacent in cubicles and someone, not forget sneeze, let's just say they're breathing even and they're infected, that's being diffused into the air, although the majority of this is no question, the majority of the infected particles, if you will, are dropping before they come to you, assuming that they are more than 6 feet apart. But remember, the science behind 6 feet is sort of arbitrary to a degree. And as you indicated with your question about sneezing, it's going to get projected into the air even further. So
exactly.
The prudent thing to do, and again, this is what some companies have decided to do, is that they have said, you're wearing a mask, period, at work the entire time. Now, I can tell you, in a hospital, the only time we do not wear a mask is if you have your own office, okay, and you're in your own office by yourself. As soon as someone comes to the door of my office, they're not even in my office. They come to the doorway of my office. And I have a pretty good sized office. It's probably 30 by
size of a bedroom,
and the charger.
It's probably bigger than a bedroom. Okay, like 30 by 60.
There.
I mean, it's pretty big. 30 by 50. Okay, so I might have like 1,400 square feet or something like that in my office. It's pretty good size, 1,200. And so even with that size of office, I'm at the other end of my office. When someone comes to my door, they have to have a mask on, and I put the mask on as I'm talking to them. Okay, and so when I'm in my office by myself, no mask.
Charge up there.
But if I were at a working in a individual, multi-person station, everyone wears a mask. If I was working in
Problem now.
Some proximity and yes, sneeze, etc., I would 100% recommend the employer considering people wearing masks. I think there is a lot of feedback, and if people are not unmuted and not talking, you should probably consider muting everybody. But yeah, Derek, you should wear a mask. I would still wear a mask in that setting.
Okay, yeah, our employer has said only mandatory in common areas. So I do have my mask on even until I get to my cube. But like you said, as soon as someone comes into the bay, so there's the bay, and within the bay are cubes. As soon as someone comes into the bay, I generally mask up, but point taken.
Yeah, well,
Thank
I would say that if you've got multiple cubes in a bay, that's a common area. I would argue that that's common area. Area is not common unless you have 4 walls and a ceiling around you, right, and floor. That's no longer common. But if you don't have 4 walls that separate you from someone, and I will tell you that a 4-foot high cubicle is not separating, that's still sharing common space.
So the idea that the particles would, let's say, I mean, if I just sneeze straight ahead, there's still the likelihood that they would be projected up, out, around.
Yeah, when you sneeze, when you sneeze or cough, it's not, even though the majority is a laminar flow that's projected towards the angle that you're sneezing or coughing, which could be up or down. But even if you're sneezing and the majority of it's down, The spray is like this, okay? So even if it's projected down, you have a spray like that, and you're going to have particles get projected upward and downward. So we know this to be true from influenza, coughing and sneezing. So if you're in a common area, if you want to protect yourself from people who might be coughing or sneezing, I would have a mask on, and everyone should, for that matter, be protecting others and yourself by having a mask on. Absolutely. It's hard, it's difficult, it's uncomfortable, but it's, like I said, it's the only two ways that we know to prevent this is by masking and really hand hygiene.
Okay, quick follow-up question. If I spray Lysol immediately after the sneeze, am I helping?
I don't know, man. I don't know. Who knows what's happening? I don't know that Lysol works on contact in the air with the particle. I don't know that anyone has studied that. We know that Lysol will take care of certain odoriferous insults in the bathroom. We know that. But we don't know that it decreases the risk of infection or transmission. So that's interesting experiment, but no one's done that as far as I know.
That's right. Okay, thanks.
Yeah. It probably won't hurt to send a message. If someone is adjacent to you and they sneeze, probably won't hurt just to like raise your Lysol can and spray it up in the air. That might send a message to them. Yeah. Yeah. Other questions, guys? Any thoughts?
Yes, Dr. Harrington. I have a question, but it might seem silly.
No question.
We're all on the quarantine, but I'm thinking if we expose ourselves a little, when we build up immunity instead of just, I know it's a dangerous virus, but how do I build up immunity without being sick, or just get a little small dose of the virus? Because it's out in the air, so I'm sure we all have at some point, if we tested, we're going to be positive. So would that help my immune system? Would my white cells start building up some antibodies inside of me?
Yeah, well, that's an important thought, because this is the basis of a vaccine, right? This is the basis of why there's vaccine research, to evaluate whether or not we can expose people to some parts of the virus, important parts of the virus, and then their bodies respond by developing immunity that prevents an infection, right? When you get exposed to the real thing. That's the whole principle behind the vaccine. Well, the reason why this is, the vaccine research takes so long is because people have to deal with safety first, and they have to also find the right dose for a. So you're probably some amount of exposure out there that would give us some immunity, but I don't know what that dose or exposure is. We know that if you get exposed to too much, which has happened to healthcare workers and young doctors who've died, who are otherwise healthy, they've died because they got exposed to too much over a prolonged period of time, if you will. And so too much exposure, we know, can make you very sick. Likewise, we know that probably very passive, limited exposure will not make you sick and may not even challenge your immune system at all. So this is why, for example, like I will go out and ride a bike or go for a run, and in the air, I'm not going to run in a pack of people, but I'm not worried about getting infected, okay, at all. Now, having said that, do I think my immune system is reacting or developing immunity when I'm going out for a jog? Probably not. Why? It's because the immune system works by having certain thresholds of exposure. And I don't know that being outside in the open air with very few people around me gives me an appreciable amount of exposure that would allow my immune system to work or to be activated, if you will. So it's a really important question, but the challenge is how do we control the amount of exposure? There's no way to do that. We know that the amount of exposure, if you go for a walk, is probably very, 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 very low, like minuscule. And it's probably so minuscule that it doesn't even give us immunity. Likewise, I know that there are people who've gotten sick, like deathly ill, from people who are asymptomatic. Like the person they got exposed to was completely asymptomatic. So I'm not sure if we are able to control the level or the amount of exposure. That's what some of the vaccine research is really trying to establish. And once we get more information on that, then I think the smart thing to do is to be able to expose ourselves in a more controlled manner. Having said that, what again you can be reassured of is that if you're healthy, you're active, you don't have chronic illnesses that are out of control, that even if you get exposed and get infected, the chance that you have a complication, meaning that you're hospitalized, any further complications beyond that and death, is really, really, really tiny. We went over those numbers last week. It's extremely, extremely unlikely. So good question, but it's a really hard one to answer and no way to control the dose of virus that you get exposed to so that you can keep it quote unquote safe. There's no way really to do that. Okay.
Okay, so I have a question, Dr. Harrington. Isn't it wise that we build up our immunity with the exercise, the fresh air, the sunlight, sleep, and all those things? So we build up so it doesn't matter. So our immune system, we can fortify our fight against any disease that comes our way?
Yes. Next question.
Okay, so next question is what about herd immunity? That's the next one after you finish that one.
Well, hold on. But yes. But I know I preach this to some of the people on the phone on this line that I talk to sometime. I preach this all the time. The most important thing affecting your immune system right now, today, this moment, is since most folk here on this line are spiritual, faithful folk, and I don't want to start preaching, but for the heck of it, the most important thing that's going to affect your immune system is faithlessness and hopelessness that leads to stress. Stress, chronic stress, is the most important factor that actually impairs and impacts our immune system, leading to chronic inflammatory diseases, autoimmune diseases, cancer, you name it, hypertension, diabetes. That's been studied. That's not like hocus pocus science. That's been very well established and studied. And I say this over and over and over again. So yes, nutrition, exercise, meditation, all those sort of things are extremely important in your immune system. But if you still walk around in between those activities and time, stressed out, worried, you might as well have done none of that, okay? So it is important for us to maintain our faithfulness, our hopefulness, right? Our love-centered lives that actually allows us to actually not be stressed, to actually take in information, digest it, make decisions, and move forward in a faithful, strong manner, and not hold on to those things which and worry about those things which we can either not control or are in the past. And so stress, I'm sorry for this little sermonette, stress is the most important thing that's affecting our immune systems before COVID-19, during COVID-19, and after COVID-19. I can get an amen or hallelujah, and then we can go to the next question.
Amen.
Amen and hallelujah.
Amen.
Amen.
All right.
Are we glitchy? Are we glitchy to you?
No, I don't see you. I just want to be sure that y'all heard me. Second part of the question. Go ahead.
Oh, so what about herd immunity? I've heard about that. So can you kind of expound on that, please, sir?
Yeah, so we talked about that. It's a good question. It's going to keep coming up over a while because it's what we're trying to get to. So a couple of weeks ago, I gave people sort of a visual example of herd immunity. And basically, herd immunity is the notion that if enough people in a population have immunity to the virus, then the virus no longer survives. So this goes back to the principle that a virus is a living organism, just like you and I. We are all living organisms. The virus is a lot more simple organism, but no matter how simple that organism is, it still wants to thrive and survive. And in order to do that, it needs a living host. In this case, the bat or us, okay? So now that this virus is in humans, it decided it likes to live in humans. Now, in order to live in a human, it has to infect the human. In order to replicate in the human and thrive, it actually has to have a host that is susceptible to the infection, susceptible to allow for the replication. When you have a population of people, say 100 people, and the majority of people have not been infected, that virus has an opportunity that is tremendous, like amazing, and will just run through that population of 100 people over a period of time. If, on the other hand, people have already been exposed, infected, and they have immunity, and the immunity can come because you've had a vaccine, or the immunity can come because you've been infected before, and now your infection is resolved. Now, instead of having 100 people with no one having immunity, no one being infected, say you have 70 of 100 people who have actually been infected before, and now they're no longer susceptible. That virus can't find any place. It's hard for that virus to find a susceptible individual, and that virus will die. Okay? So herd immunity is just a way of saying that the majority of people in a population have already been exposed and therefore have an immune system that can readily fight against infection. And typically we say that you need somewhere between 70, on the low end 60%, but somewhere between 70 and 80% of the population to have been infected or exposed or vaccinated to have herd immunity. So right now, we're probably close to maybe 10%, 12% at best, being very generous, of people in LA County being exposed. We have a long way before we get herd immunity, right? So if you took 11 million people in LA County, just say being generous, 1 million people have already been exposed. We still need another 6, 7 million people to be exposed before we have adequate herd immunity. When you have adequate herd immunity, the infection or the virus cannot thrive because it can't find any hotels, if you will, any human hotels to get a good night's rest and to eat and to multiply, right? It's just nowhere to sort of lay the weary head of being a virus, and they just die off. So herd immunity is a really important concept, and that ultimately, when we talk about infections, particularly viruses like this, this occurs with the flu season, this occurs with measles and polio, and depending on the lifespan and how that virus acts, sometimes that herd immunity can last for decades in a population, like in measles or polio. Everyone got vaccinated, and that herd immunity is lasting decade after decade after decade. We don't know yet whether or not herd immunity is going to work for this virus yet. We think it will. That's our best guess, and we're going down our research with the development of the vaccine with the assumption that that will work. But we won't really know until we've done the research and we see what happens in the population. Hope I've answered the question.
Okay.
I have another question, Dr. Harrington.
Sure.
I heard something today about the virus is found in bodily fluids. Is that correct?
Let me see. I did get this question, and I thought, well, I wouldn't go there on a public call like this, but let's just go ahead and put it out there, right? So there's a headline that said, coronavirus in semen. True or false, right? Can this virus be sexually transmitted? We don't know whether it's sexually transmitted. Has the virus been isolated in semen? Yes. There are reports in China, there are reports in other countries. And we know that it has been isolated. And again, there's always a difference between isolating a virus from a location, be it on the floor, on a stainless steel pot, or in sweat, right? Or even in semen, or other fluids, if you will. There's a difference between isolating the virus and that virus actually transmitting disease. Okay, so we have evidence that we've isolated the virus from a number of bodily fluids. We do not currently have evidence, clear evidence, that it is sexually transmitted, if that makes sense. So the fact that we've isolated it isn't the same thing as it actually being a successful way of transmitting it. And I think this is really important. In order for a virus to be transmitted, it has to be alive and viable. Lots of viruses, and I'll give you a good example. Go back to Derek's example. Say Derek worked outdoors, and there was someone who was clearly infected, and they were sick. And they were just, refusing to wear a mask, and they were coughing and sneezing all over the place. And the viruses were just teeming, okay? And they were working outdoors in the sunlight. And the viruses landed all on all the surfaces outdoor. The outdoor sunlight, UV light, has completely denatured those viruses. Those viruses are dead, okay? There's no question. But if I did PCR to try to see if I could detect the virus, I would absolutely find the virus all over the place. If I took those viruses and injected those into me or rubbed them in my mouth, my mucosa, I would not get infected, okay? Because the virus is no longer viable. So there's a difference between viable virus and virus that's just detected. We currently have evidence that the virus is detected in a number of fluids, including what made headlines this week or last week. But we do not have evidence that we're transmitting the virus effectively through this means. Okay, great question. We will probably have to wait and see. But I think that in general, what I would say is that for people who are already exchanging bodily fluids on a routine basis, that your risk is probably higher from being around that individual, cohabitating in the same room or house, than having other sorts of bodily fluid exchange, if you will, okay? And assuming that people aren't exchanging otherwise bodily fluids with strangers, and again, we pray that that's not happening, that's still the biggest risk is going to be, as we talked about before, through, again, coughing, aerosolization from someone who's infected, or touching, basically live virus and transmitting that to a mucosal surface. So very good question. There's going to be more and more headlines about sort of reports of where this virus exists and all this other stuff. And while I think it's important, I don't know how practically relevant it is on the one hand. And I do think that some of it personally is a little bit of a distraction. And what I want to say is it actually also adds a little bit to the stress level. It can add to the stress level. And again, I really want to make sure that you all are digesting things in a way that really is sort of relevant and practical to you, and minimizing stress. And so I will turn the question around. I know this is probably not fair, particularly since I'm being recorded, but I'm not going to turn around just to you, the person asking the question, but to anyone on the call, and ask the question: if in fact the virus was detected in bodily fluids, not just semen, but other bodily juices, saliva, etc., okay, how would that affect you? What would you do differently? Don't answer that question. But what would you do differently, right? And for those of you with partners, or you're married, or what have you, what would you do differently? Okay. So just think about that. I will disclose for myself. I don't know that I would do anything differently. I don't know that it would affect my behavior at all. Knowing that my partner, who I'm living with and around, might also be secreting or fluids that have, if you will, the virus in it. I would behave the same. I don't know that I would take any different precautions. Well, it's an important question, and it's, again, I think we have to be very careful. It's the sort of things that oftentimes add stress without adding practical benefit to us. Okay. Not a stupid question at all. Important question. Yeah.
Yeah, I got a question from NJG. She typed in chat. She got two questions. I asked her a second one first, though. How much of the threat is airborne to eyes since we are wearing masks? I mean, some barrier to breathe, but none to the eyes.
Yeah, it's an important question. Like, we talk about mucosal surfaces being the eyes, the nares, and the mouth, right? As the primary portals of entry. And again, this is all about density. So if I am in front of somebody for prolonged periods of time, what have you, I don't have glasses on, and my glasses don't perfectly conceal my eyes. You're absolutely right that there is a risk, if you will, of the virus gaining access through the mucosa or the conjunctiva of your eye, the whites of your eye. So it is a risk. It's albeit very, 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 very small. Why is this? First off, we're talking about entrance into, talking about the way this virus, and I think about 3 or 4 weeks ago, I showed the slide about how this virus works. This virus hooks into certain mucosa and hooks onto that. That mucosa lines the sort of airway system of our body. So that includes the posterior pharynx, the back of our throats, our airways, and our lungs. That's where it likes to hook into, and these receptors. We don't really have those receptors that well, if you will, on our eyes, number one. Number two, which is really important, is that, remember, unless you suffer from xerophthalmia, which is dry eyes, everyone has continued eye washing that goes on continually, which is our tears. So everyone has a layer of tears that are always coating your eyes, that's always circulating. It's like a 24/7 windshield wiper, if you will. And then we blink, we're doing that. And people blink, you know, anywhere between 5 and 15 times a minute. So from an eye perspective standpoint of view, we have built-in mechanisms, wonderful built-in mechanisms that make the eye a very low risk of transmission just from things floating in the air. Now, that's different than if I have a finger that's infected. I then take the finger that's infected and I then rub my eye densely. So just from airborne viral particles floating around, I talked about this last week, viral particles floating around aren't looking to like stick to you. They're not. They actually, like the air, are trying to just get by. It's called laminar flow or laminar physics. It literally is just trying to move by you. So unless you are in healthcare, unless you're doing highly aerosolizing procedures, people who are breathing and talking normally and even coughing from a little distance away, and that gets aerosolized, if you will, that portal of entry into your eyes is really not an important risk factor for anybody. The bigger risk is breathing something in, which is why you wear a mask over your nose and mouth, not just your mouth, but your nose and your mouth. That's probably your bigger risk. But your eyes, extremely important question. We're not wearing goggles and airtight for that. Because our eyes work the way they work, passive aerosolized droplets in the air being absorbed through your eyes, penetrating the tear and the blinking protective system that you have going on, causing an infection and getting through the rest of your immune system to cause an infection into your lungs is very, very unlikely. So such an important question. In healthcare, we wear goggles when we're doing procedures, et cetera, because now we have a much higher density of virus coming at us because it's under pressure. Other than that, there's no recommendation, even in healthcare, to wear facial coverings, etc. Okay, just droplet precautions with a mask. So very, very good question. Hope I answered that.
Thank you.
Yeah.
Well, since you were talking about being in healthcare and so forth, I was wondering, you said earlier about they extended the stay at home, but I got a note or email today that the Dental Hygiene Board saying that we can go back to work. So does that just depend on what county I work in, or?
Yeah, so the governor, so really, really important. So the governor, from a state standpoint of view, has put out broad sort of guidance and expectations. And if you read the governor's order from yesterday, even last night, he's leaving it up to the individual counties and municipalities to decide which businesses and what pace needs to come online. So that's important. And it's important to think about how you, when you come back, how you protect yourselves. So, I think you and I talked about this before. Businesses have to really make sure that they're first customer, employee, second the customer. And that plan and strategy should be extremely clear, should be at a minimum consistent with what the governor has outlined, if not the CDC, when the CDC releases their guidance, which will be a little bit more specific and explicit. But your protection as an employee is important. And if you feel uncomfortable that you're not being provided the right resources, the right guidance, the right personal protective equipment, etc., then you need to deal with that with your employer rather, to be sure you feel comfortable doing that. But it is the requirement of the businesses and employers to have certain measures in place. And depending on your job, your exposure risk is going to be different. If you're working in retail, you're going to have very transient casual exposures. All you'll need to do is be able to wash your hands, be able to control the density of people in your business, and have a mask on. That's it. And maybe require other people who are coming into your business to have a mask. That's it. But if you're working in an industry where you have a higher risk of exposure because of the type of work you're doing, I'll just put something random, like in dentistry, dental hygiene, okay? And you're working with tools and instrumentation on patients that the procedure does pressurized aerosolizing of secretions, etc., then you need to be properly protected for that. And that should be consistent and clear with whatever the professional guidance is for those boards, which usually have explicit sort of guidance around it. I can tell you in healthcare, we have different specialties have come up with very specific guidance. So head and neck surgeons, they have put out guidance. Thoracic surgeons have guidance. You know, the dental boards have put out guidance. You know, critical care has put out guidance. Anesthesia's put out guidance. You know, these specialty boards have been very prescriptive about what they think is really important to protect their specialty members. So I would look at that to be sure that your employer is complying with that.
Right. Yeah, they did send out a list of what we should have, and but I guess I was just confused because some other coworkers and colleagues were calling and were like, "I'm confused. I thought we," and I'm like, "I don't know. I think it has to do with the counties and whatever your mayor says, if we're able."
Yeah, and the shelter in place and stay at home will likely be in place on one level or another till August. It doesn't mean that all sites, venues, and or employees and employers will be affected the same. So as many of you know, they've already started opening up the beaches. They've already started opening the park. But when you go to the beach, you can't take an umbrella or a cooler or a blanket, right? You got to just keep it moving, go for a swim or go for a surfing lesson or what have you. But you can't come back and sunbathe. You can't sit up and pop open a beverage and just, you know, chill and look at the waves. We'll see how they enforce that. But again, how they're opening things up and what they're doing comes with caveats. So, you know, again, important to look at what exists in your respective city/county.
You know what? I just want to chime in on that because I was listening to what's her name, Ferrer, Dr. Ferrer.
Yeah, Barbara Ferrer.
Barbara Ferrer, and I'm not sure what phase this is in, but I guess whenever they do gatherings, when do you foresee us even going back to church? We don't have a large congregation, but you know, when do you foresee that happening?
Yeah, so I mean, that's going to happen in the coming weeks, as long as we don't have a ballooning of cases. As long as that line I showed you that was previously flat doesn't start going up. They'll probably open up congregations again. And what's going to happen again is as they begin to open different things up, businesses, venues, etc., sporting venues, everyone will have to have a mitigation plan for how they're going to minimize people being infected. Simple as that. And then the trust that businesses, venue owners and organizers, and participants or citizens are going to adhere to that. That's all. So I think that this is really important. So that means that maybe it's Southern California Conference, maybe the governor, the next year, whatever, you know, the churches and mosques, they'll put that out there, and then they'll have guidance for what they expect for synagogues and mosques to do. So for right now, restaurants are on the list, right? And if you look at what restaurants have to do, they've spelled it out. What restaurants actually are required to do to reopen, both indoor dining and outdoor dining. So they've spelled that out. And when they start, you know, again, opening this up to venues, including, you know, like congregate gatherings like churches, I guarantee you the governor and the governor's staff will put out guidance for what they expect to happen. And remember, the guidance is, this is not going to go away. So all the guidance is going to center around three things, maybe four, but three things for sure. One, okay, mask. When you go into these gatherings, into these areas, you must have a mask on. That's not changing, okay? Two, this idea that you will have to have some capacity limitation. So we have a church, the church is so big, and we're only going to allow so many people in that church. So that will have to be predefined, and someone will have to enforce and monitor that. Just like at Home Depot. I was at Home Depot this weekend. They only let so many people in at a time, okay? Three, there will have to be an ability for people to good old hand hygiene, okay, that they'll have to be in place. And the reason why I said maybe 4, because the fourth one, how you handle physical distancing in and above a maximal occupancy for a space is unclear. So if I say that the maximal occupancy in our church is 50, okay, that may also, with that, include how people are arranged, you know, on the pews, on the pulpit, etc. Right? But that's all. There's no rocket science. There's like no rocket science in the guidance around what we're to do in terms of kind of going back to venues being open, etc. The Professional Sports Association is already talking about this, right? They're already talking about, you know, they have a spectator list of venue, but allow people to compete. Do they sell out tickets the same way, but actually only have so many people sitting, you know, in proximity to each other? Do they allow people to sit next to each other, but do they just make sure everyone has a mask on and are doing hand hygiene? I mean, everyone's trying to figure this out. Like, guarantee you, venues will open back up, churches, synagogues, mosques will open up, right? Malls will open up. It will all open back up, as long as we don't see some huge rise in spike, and everyone will be required to address the things I just. That's all. Most of that will be on you as an individual to personally safeguard yourself. So, am I wearing my mask? Am I making sure my hands are washed? I'm not just touching any and everything, etc. Right? And then the organization will have to be really putting things in place to try to enforce or educate the participants or the public utilizing their space. So we're in, by the way, sort of phase 2-ish of that tiered opening, if you will. Okay, we're in sort of phase 2.
Dr. Harrington, what you mentioned about people getting ready to open up. I actually received a survey from Universal Studios about COVID-19 attitudes about what would it take to bring me back to the park. They mentioned about 25% of capacity, we want to spend more money, but they also mentioned about screening. They listed about 5 different types of screenings. One was temperature screening. The other one was just looking at somebody to see if they're coughing screening. And they mentioned like 2 different type of blood test screening. I can't remember what they were, but there was 2 different type of blood tests to see if you're have COVID-19. And I can't remember what the other one was, but they are looking at different ways to what would make people comfortable in coming back. So
no, I think that's right. I think everyone is trying to, everyone's trying to figure that out. Yeah. So the question
is, there actually any type of blood test now for the COVID-19, or are they just thinking there may be one in the future coming up?
No, not our tests, but the tests are not as accurate when people are asymptomatic. That's the biggest challenge to some of the tests that are available. When you're asymptomatic, there are 2 things that can occur. One, you could have actually been infected for a while. But the virus that you were so small that you didn't have an adequate immune response, right? The second is that not enough time has gone by. Remember, I showed you that incubation period is 5 to 15 days. So say you got exposed 3 days ago, 4 days ago, you go to Universal Studios, and the bug is still replicating in your body, but so not enough time has gone by. You come into the park, you actually have an infection, but the test doesn't detect it. Now, the good thing is that if the test doesn't detect it, the chance that you're infectious, meaning contagious, is probably pretty low. But it doesn't mean that you don't have the infection, if that makes sense. So the problem that people find with some of these tests are, on the first part, is that a lot of the tests that have been actually put out there have not been FDA approved. They've been commercially sold, We don't know how good they are, whether they work. So that's a big problem with the testing, regulating the testing, making sure the test is the right test, it's a good test, it works, it's reliable, etc. That's just a generic problem with testing, particularly some of these blood tests. The second is having a negative test doesn't mean that you yourself aren't infected and may not actually have problems later. And because the test is only so good, you can actually have the disease and be contagious and the test miss it, okay? Because you're asymptomatic. So the testing issue is a challenge because it doesn't necessarily adequately reduce the risk to next to zero from a transmissibility standpoint of view. But it is a start. We're getting there. We're moving in that direction. It is likely that remember, if someone actually was starting to do testing, they're going to transfer that cost to you. I guarantee you, in the price of admission. It's more likely that people will thin out the parks in terms of the number of people in the parks, thin out the rides in terms of the number of people in the rides, and therefore thin out the line, the queuing going to a ride. They will likely require people to wear masks while they're in the park and see what happens. They'll probably restrict the park to people who are otherwise healthy and prevent people who are chronically ill or frail or elderly from coming to the park. They'll do things like that, right? Which I think is, it's one way to try to open up and provide access to people for, things that people are interested in doing, including, this is the same thing that's happening in discussion that people are having about going to the movies, right? So you go to the movies, how can I, have people be patrons, go to the movies, have a movie experience, and minimize the risk of people getting infected? I can't reduce it to zero, but how can I minimize it? So when you buy your movie tickets, there's going to be some waiver, I guarantee you, that puts it all on you. And then they will have queuing in the lines. You'll have to wear a mask, but you're eating popcorn, but you have to wear a mask, but you're eating popcorn. Or no popcorn. Well, now how fun is that at the movies, right? So they'll be working this stuff out. And some of that risk will be reduced, but it won't go to zero. I guarantee you that it won't go to zero.
Thank you.
Good. All right, we are an hour and 15 minutes. Lots of good questions tonight. They just kept coming. I appreciate that. Thank you for sending a couple of questions in advance. If you have other questions in advance you want to send, please send them to David or Pam, or you can send them to me directly. If you have my contact information, that's fine. And again, you can also during Q&A, which we obviously have ample time to ask your question here. Don't be shy. All questions are valuable, important questions. And if you have that question, I promise you, someone else has that same question. So you're just helping someone else and helping us all. Again, thank you for your time. Thank you for your patience and your thoughtful questions. And we will see each other next week. So stay safe, stay even more safe. Okay. Until I see you next week. And so we can bow our heads for a quick word of prayer.
Dr. Harrington.
Most congregation Father. Yeah. Here we go. Go ahead.
Okay, sorry. I just want to let everybody know that all the past sessions are recorded, and the way it's organized, the question, you click the question, you get the answer from Dr. Harrington. So if you want to look at past sessions, they're all recorded on the website, and you can review them at any time, just for people's information. Sorry, now you can pray, sir.
That's impressive. And now knowing that, I will actually do my best to frame my answers so they're independently viewable. Okay. So that's really very helpful. But that's so good. And before I pray, let me just say again to David and Pam, you guys are awesome team, awesome team. And I appreciate your leadership, Pam, in Health Ministries, help, getting this together and supporting this. This is whether we're helping one, a dozen, or 100. This is so valuable and important to people. So I appreciate that. And it's a pleasure for me to, spend the time trying to help people. So again, thank you for the work that you're doing and even the work behind the scenes to make this accessible for people who can't participate and to make the content easily accessible. So again, thank you all very much. All right, we'll pray real quick. Most kind gracious Father, again, we pause to say thank you. Thank you for the opportunity of life, of each breath that we sometimes take for granted, moment by moment. We thank you for the opportunity to share, to discuss, and to ask questions and curiosity, and hopefully not out of desperation, but just to help us understand and edify our practice and our thoughts a little bit more that will make us more comfortable, more certain and sure that we are doing the right things and walking the right path. May this be useful not to those who are just hearers of this word on this call, but to any others who might come later, as well as to those who might have contact with someone who participated on this call so that they might actually be able to give the gift of knowledge and share it to them. Thank you in a special way for Pamela and David for their hard work, discipline, and commitment to this. For without them, we would not have such clear information to go on beyond these live sessions. So I'll continue to bless their relationship and bless their work and keep them healthy and safe. Now, as we move, we ask that continue to give us the faith and the hope that keeps us day by day stress-free, with bolstered immune systems, and fill our lives with gratitude and love, and the assurance that we serve the living God, and that we are strengthened and all powerful because of just that simple fact. In Jesus' name I pray, amen.
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 All right. I'm out. Thank you, guys.
Thank you.
Thank you.
Night, night. Thank you.
Thank you.
That's,
Thank you, Doc.